The E4 allele of the ApoE gene is a common and well-known risk factor for Alzheimer's disease, but it's also associated with an increased risk for coronary artery disease. In a randomized controlled trial, we found that disclosing this additional information during a genetic risk assessment for Alzheimer's disease not only helped healthy adults cope with indications of an increased risk for disease, but also appeared to motivate them to make additional health behavior changes to reduce their risks. We were motivated to undertake this study because of the way DNA testing has been evolving. The cost for sequencing has been dropping rapidly, and many commentators envision a future where sequencing of patients is a common part of routine healthcare. More than most medical tests, genomic sequencing may identify information that has relevance to patients' well-being, yet was unrelated to the reason testing was ordered in the first place. In fact, the American College of Medical Genetics recommends that anytime whole exome or whole genome sequencing is ordered, that laboratories query at least 56 additional genes for pathogenic variants for conditions such as hypertrophic cardiomyopathy or certain types of colorectal cancer. ApoE's association with two separate diseases provided an elegant way for our research group to try to understand the impact of disclosing secondary findings to patients. We told all participants at the point of enrollment that they would be receiving genetic risk information about Alzheimer's disease, but only half of our participants were also informed during consent that they may receive additional information about an unnamed condition. In this way, we were able to conduct a randomized control trial about genomic secondary finding disclosure, which should provide information that's critical to the way genomic findings are disclosed in the future. One of the most challenging parts of our study was deciding how to disclose the ApoE coronary artery disease association to our participants. Our research group grappled with questions such as whether or not to provide numeric estimates of coronary artery disease risk and whether or not to provide ways of reducing that risk. Certain members of the research group, myself included, were concerned that the statement we ultimately developed was not strong enough and that participants might not understand or recognize the importance of the additional information we were giving them. In fact, we were pleased to see that not only were participants internalizing that additional information they were receiving, but they were responding to it positively, both behaviorally and psychologically. The REVEAL study has provided the foundation for ongoing research in our Genomes to People research group, led by Dr. Robert Green. The practices we developed as part of the REVEAL study serve as the foundation for studies such as the MedSeq project, a randomized controlled trial of integrating whole genome sequencing into the primary care and cardiology care of adults. In addition, the REVEAL study practices serve as the foundation of the BabySeq project, an ongoing randomized controlled trial of whole exome sequencing in the care of newborns. And so the findings that are presented here in Annals of Internal Medicine are important not only because of what they say about patients' ability to understand and respond to genomic secondary findings, but also because the methods we implemented serve as the foundation for high-profile studies of genomics.